Thank you and I welcome you to our mental health seminar. But before I get started, I want you to take a piece of paper and I want you to write on that paper, one, what do you think mental health is? Okay? Because you're going to share this at your breakout session. And the second question is, why do you think mental health is important? You don't have to write a paragraph. Just share it and write it on the card. And what we're going to do at the breakout session with Dahlia, she's going to have you exchange your cards and have someone else at the table share it during our breakout sessions. Again, what is mental health to you and why do you think it's important? As you continue to write, I'm going to play this video. This video is going to give you more of a glimpse of mental health and what it is, and also more information on our seminar as we go ahead and move forward with today's programming.
We all have mental health. It is just as important as physical health. It is not only about mental illness or mental disorders. This is just one part of a bigger picture. It's best to think about mental health as being on a continuum, rather than people being either mentally ill or mentally well. We are all on the continuum, and we move up and down according to factors such as our genetic makeup and upbringing, our life circumstances, and the stresses we are under. At one end of the continuum, we have mental disorders, like depression or anxiety. And at the other end, we have states of positive mental health, when we're thriving, content, and fulfilled. The aim of mental health interventions is to move people up the continuum, so that they're able to reach their full potential and live satisfying lives. The World Health Organization describes mental health as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Being mentally healthy means being resilient and able to cope with difficult times, feeling in control, being confident, feeling good about yourself, managing and expressing your emotions, building and maintaining good relationships. We all experience periods when we feel stressed, worried, anxious, sad, afraid, or angry. These are all normal emotions. However, when these emotions become severe enough that it interferes with a person's ability to function daily, and these feelings become persistent over time, then it can develop into a mental health problem. There are many different types of mental disorders. When left untreated, mental disorders can be chronic and long-lasting, and are associated with increased disability. They significantly have an impact on daily functioning and frequently interfere with family, social, and work responsibilities. Fortunately, there are effective treatments and evidence-based interventions available that aim to help individuals understand and cope with symptoms of mental illness. However, very few people with mental disorders access existing treatment services. This may be due to barriers such as the stigma attached to seeking help, the lack of understanding of mental health problems, uncertainty of how to get help, or the fear of disclosing mental health problems. Research shows that stigma remains one of the biggest factors preventing people from seeking help early for their mental health problems and getting the appropriate support they need. It is important to acknowledge that we all have mental health and have a personal responsibility to learn how we can improve and maintain our well-being in order to lead meaningful and satisfying lives.
remainder of the next half an hour, and we're going to discuss 3 different areas of mental health. The first area being spirituality. How does spirituality has an impact on you having healthy well-being and mental health? The second aspect of our seminar today will also talk about the value of therapy and mental health, talking to someone and having a support group or a person support you through mental health. And lastly, we'll have a message by Tony. He's going to talk about the importance of physical fitness and mental health. Now, I'm going to be completely transparent now and vulnerable. I struggle with mental health issues. And as you saw in that video, this is one thing I've learned in my own life as someone that counseled many people in the different capacities in which I serve, is that we all have a level of mental health issues. Now, you're like, wait. I don't have a disorder. No, I'm not saying you have a disorder, but in each and every one of our lives, there will be times where you will have mental conflict. For you, it may be a loss of a spouse. It could be a loss of a loved one. For you, it may be financial problems. It could be tensions with relationships as it pertains to your children or your family members. But in that video, as you saw, mental issues come in all shapes and sizes. While we do acknowledge that mental health issues is a real thing, today we're also going to acknowledge that there's something that you can do about it. I sit with people who find themselves powerless and feel like they can do nothing about it. This is how I am. This is my situation. I just have to deal with it. But one thing I want to say today is simply this, and I want you to hear this clearly if you hear nothing else. You do not have to deal with it alone. And so today, as we go through this seminar, there may be high points where it's very interesting. There may be points where it's very informative and information, and you take that in. But throughout this seminar, I want you to take note of the different ways that you can improve your mental health, because this is not a one-size-fit-all type prescription. This is not a one-size-fit-all type techniques or remedy. But for each of you here today, you will find something, and from the people that's speaking, that will help you take your well-being to the next level. So can we agree to participate and engage in today's seminar? Absolutely. So it's going to be great. So I'm going to open up by talking about spirituality and mental health. This is something that I speak adamantly on. Now, let me just say this as well when I start this conversation, is that I'm a chaplain, which means that when I speak to individuals all over the U.S., whether it be in the Army, whether it be for cities, counties, or this community, I speak from the standpoint of a chaplain. Everyone in the room has different belief systems. Some people are Protestant, some people are Catholic, some people are Jewish. We don't have any Muslims in the room right now, but each and every one of you have a different level of spirituality that differs at the table. So when I'm speaking today, I'm not speaking from the standpoint of religion. Let me just put that out there, or my own spiritual belief system. I'm speaking from a place of research. I'm speaking from a place that where people have researched the effects of spirituality and how it makes us whole and adds to our well-being. So let me just preface this conversation with that opening. Now, also, in seeing that everyone has a different spirituality, I want to distinguish between spirituality and religion. What I'm not communicating is that you must have a religion when you leave here today. That's not what we're communicating. Okay, let me say this again. You can say, hey man, I'm atheist. I don't believe in this whole spirituality. No. Even if you're atheist, you have a level of spirituality in your belief system. Even if you're agnostic, whatever it may be, we're not preaching religion, we're preaching spirituality. So what is spirituality? Spirituality involves the recognition of a feeling or a sense of belief that there is something greater than myself. Can anybody agree with that? Yes. There is something greater than I. Some people call this person God. Some people call this thing science. Some people call this thing oxygen. Whatever you call it, maybe you hug trees and you say, hey, trees are greater than I. That in itself is a spirituality. Okay, so spirituality, just put that out there, is not a religion. It's the belief that something is greater than myself, and that there is something more to being human than a sensory experience that I see every day. Okay, everybody agree? That is what we get when we get spirituality. Now, as it pertains to spirituality and mental health, spirituality help us bolster and maintain our mental health in so many ways. I have found in my own ministry and my many positionings that spirituality creates a sense of purpose and meaning. When I sit with people and I'm counseling them, one of the first questions I usually ask them before I get in any counseling section is this: what is your belief system? Because here's what I know. Your belief system is going to tell me your ability to have hope in the toughest times. You walk in my office, you say, hey man, I don't believe in anything. The world sucks and then at that point, I'm like, okay, my mind automatically goes, how can I help this person see hope? Hey, Chaplain, I'm Jewish. Okay, how about we go to the Old Testament in the Torah and talk about how David dealt with adversity in the book of Psalms? Hey, I'm Christian. Okay, how about we go to the New Testament and see how Paul dealt with adversity in the book of Ephesians or Romans? Hey, man, I'm Catholic, Pastor. Okay, let's see what the Bible says. So, again, religion, spirituality. Hey, I believe in trees. Okay, how does trees make you feel when you see a tree? Does it give you a sense of joy? Are you hopeful when you see the tree grow or when you see a flower on the table? You can say, hey, flowers makes me hopeful, and that's okay. But I've also discovered that the people that I speak to in the worst state are those that have no sense of spirituality. As a counselor and a clinician, the hardest part of me counseling an individual is a person who has no spirituality whatsoever. And at that point, they see nothing more. They see no purpose. Life has no meaning. So understand, when we're talking about spirituality and you're in a really tough space and you're dealing with a mental health crisis, spirituality is the one thing that gives you hope and purpose. It helps you see that there's more to life than the struggle that you're actually going through. So I'll put it this way: spirituality serves as the base of a supportive community, outlining specific practices to help you work on your relationship with yourself and others. This slide right here comes from the military. So I took some military stuff to put into this slide. We have a program in the military called Master Resilience Training, okay? The military has discovered that a lot of our soldiers, it's important for them to understand and be grounded in spirituality in order to navigate through the toughest situations. This is why the military has chaplains and see the chaplain as the primary driving force of motivation, morale, and spirituality. As a chaplain, my job is to make sure everyone has a healthy well-being. And what we're talking about today, I incorporate the mental, the physical, and the spiritual all together, and I help soldiers experience well-being. So that's what we're doing today. So based on the military research, they found out four things. Spiritual readiness is the ability to endure and overcome times of stress, hardship, and tragedy by making meaning of life experiences. For instance, the death of a loved one. Grief is difficult. If you don't believe in something after death or some type of spirituality, you think that's it. And I found out those individuals never grieve healthily. Like, for instance, me personally, in my faith tradition, I believe there's something more after this life. So one day, I'm going to lose my wife. One day, I'm going to lose my parents. But while I will grieve their loss, I believe in my faith tradition that there's something more. Because I believe there's something more, it helps me cope with the hardships. Or if I'm going through a financial problem or a hardship, I'm able to say, hey, this is temporary and there's more on the other side. When you don't have a spiritual sense or foundation, you'll find yourself not believing there's something more, or find yourself without hope in every situation. And this is what it's saying here. Meaning can be found in exercising beliefs, principle, ethics, and morals arising from religious, philosophical, and human values. Spiritual readiness is the ability to sustain, develop, and persevere while facing adversity, knowing that you're grounded in your spirituality. And this is where this is the components of spirituality. When you're thinking about spirituality and the value in your mental health, it brings you purpose. It creates core values. And think about it. Your moral value makeup is based on your spiritual belief system. The reason why we believe in right and wrong, it's a natural thing in our mind, yes, but a lot of our rights and wrongs are dictated by what we believe in a spiritual sense. It creates your identity, it gives you a life vision, and it gives you a philosophical exploration. Keep that in mind. Again, this is not religion, this is spirituality. And all of these 6 points, whether you're Jewish, whether you're Christian, whether you're Catholic, whether you're Muslim, whether you're Buddhist. Every religion, for the lack of words, brings us these 6 areas in our lives. This is why I believe spirituality is the basis of a lot of what we do. This was research done by the military. The military did research in understanding the impact of spirituality on the life of our soldiers. And they said this: a multitude of researchers have established that spirituality, quality of life, and stress coping are all proportional, not one or the other. If we can enhance our spirituality or our stress coping, we can increase the quality of our life. Have you noticed that people with a deep spirituality, this is not a fact, this is my observation, live better lives, better quality of lives? They're able to navigate better. A lot of people that's dealing with stress and mental illness and a lot of the stressors, those are the ones who usually die from these chronic diseases because it's linked to stress. I once had a back pain here for a very long time, for years. I did everything. I had the shots, I had the exercises, I did everything. But I found out that once I went to therapy and got connected to my personal spirituality, those pains went away. But I tried everything in the physical realm and I ignored everything in the mental and spiritual realm. And a lot of the body pains that I was going to was due to the external stressors causing internal pressures on my body. So this is what this is saying. You have a better quality of life when you deal with the perception of spirituality, stress coping, and the quality of life. And it created something called PERMA that the military uses. All right. There's also something called spiritually augmented cognitive behavior therapy. Now, research have shown us recently that there's a new form of therapy that's being formed that's based on spirituality. This isn't Christian therapy. This isn't Jewish-based therapy. This isn't a Muslim-based therapy. It's based on spirituality. It's a psychotherapeutic method that involves including spiritual values in cognitive behavioral therapy. So in other words, research is starting to point and discover that spirituality plays a great part on a person's health. They have now involved certain techniques that focus on acceptance, hope, achieving meaning and purpose, and forgiveness. Because a lot of these areas of your life contribute heavily to our mental state. And they use in this techniques listening, encouragement, problem solving, and the use of medication, prayer, rituals, and monitoring the effects. Anybody in here pray? Anybody? I'm gonna pray. Anybody here pray? Like just pray? Okay. And if you ask those prayer people that prays a lot, you'll see values. Whether you believe it or not, when you're praying in your spiritual sense, whether you're praying to your God or praying to trees, prayer does more for you than it does for God responding to your requests. It's a way of positive affirmations. When you're saying something and you're putting it in the universe, your words have power and you're praying that thing into existence. So if you're going through a tough time and you're praying against depression, Lord, I pray against depression today. Not saying that it's going to go away instantly, but what you now are saying is from your mouth, I'm believing that things will get better. I'm believing that change is coming. And this is one of the most valuable parts of spirituality, is the ability to speak to the higher powers and put it in the universe and see something move in a certain direction. All right, so the big question is why? So why, chaplain? Why should I take part in spirituality as it pertains to my mental health? Okay, spirituality gives you a higher sense of purpose, which we discussed. It helps you experience confidence, self-esteem, and self-control. And it helps you make sense of your experiences in life, okay? And it gives you spiritual community that allows you to work better through relationships and other people. One thing I've learned in my life is that when I'm going through something and I'm sharing it with other people, it takes the burden off of me and help people walk with me. So many of us holding all of our problems, we have no community to share it with, and we die alone. Let me say this to you today. You do not have to die alone. It's a choice. Everybody say it's a choice. It's a choice. And this is why I always emphasize people in my counseling sessions to find a community. If you're Jewish, find a Jewish community. Find a temple to go to and interact with people. Some of you here today only come out for breakfast, come out for lunch, and you go in your room and you go in your apartment and you're dying inside because you have no community. You're Christian, I tell you to go to a church. If you like trees, go to a park and hug trees. Community. Whatever it may be, spirituality gives you community and allows you to share your burdens and your person, your struggles, and it gives life meaning. So this is why I believe it's important. So here's a couple of recommendations that I want to talk about really quick. it says to read inspirational books. That's part of spirituality. Whether it be a Bible, whether it be a book that's written from someone in your faith. It could do that. You can do meditation, read from the Torah. You could walk outdoors. You could pray alone or with a group. You could practice yoga. Anybody like yoga? I just started. I'm 6'7". It hurts a lot. Let me just say that, okay? I'm learning. I'm getting there, but it hurts a lot, but it works. And this is what I think about yoga. I think it hurts so much till you stop thinking about your problems and you just want to get it done, right? Like that's what I believe. I believe it hurts so much till your problem just goes away. You be like, oh, this is the real problem, not that, right? That's the real thing. Playing sports. Anybody like the car? Who plays cars in here? Anybody play cars? That's like half of the room. Come on, let's be honest. I know it's more. Card players. Poker. Okay, Stu, I'm looking at you, Stu. That's why I said poker, Stu. And whether you believe it or not, every time I walk by, I'm going to be honest, I walk by and I watch the card players and I watch those playing poker, they're happy. Not the bridge players. Not the bridge players? Those that's losing aren't happy, right? But here's why I bring that up. Whether you belong, believe it or not, that's community. That's getting together, getting your mind off your problems and being involved in community. So again, anybody play chair volleyball? Chair volleyball? Listen, I play that every Tuesday and Thursday. I'm giving a little pitch to tell them to join Antony. It is amazing. If you never played chair volleyball, it's very addicting and it's very fun and aggressive, but fun. Ain't that right, Tony?
Come to the beach 200.
You're the aggressive one.
Okay, I'm the aggressive one, but it's fun.
Correct.
That's it. But so this is my recommendation for spirituality. I want to thank you guys for listening. I hope I said something that encourages you to find your inner spirituality. I don't know what that may be, but every single one of you have the power within you to find that inner spirituality and grow in your mental health. Thank you.
I'm going to continue what Barnabas was talking about, spirituality in therapy. And I'm going to continue with it by giving you some statistics from the psychologist's point of view rather than the chaplain's. Oh. Is it on?
No. There you go.
Okay. Hear me now? Okay. I'm going to continue from the perspective that Barnabas was talking about, spirituality and therapy. But from a psychologist's point of view, and I'm going to add some more statistics to it because they are really very interrelated. When Barnabas was talking about purpose and being able to connect to that, that is something that I don't know how many times I hear from my patients, whether they're in their 30s, 40s, 100. Why am I here? What is my purpose? And that's something that isn't answered from an emotional perspective, but actually from a spiritual perspective. Also, we find that people who have addictions that go to AA and NA, a big part of those programs is a higher power. And they don't name what the higher power is. I mean, for some people it might be the doorknob, but the fact that there's something outside of yourself that is more than yourself. 80% of the people that get that part of it, the spirituality part of it, make it in the program. The people that don't make it in the program, they're missing that key piece of being able to connect to that, which shows you some of the power. Whether there's anything out there or not doesn't matter. That's why they talk about it could be the doorknob. It's what you're able to connect to and believe in. So it's important for you to see it works. There's more and more cognitive therapy that is incorporating spirituality into it. One of the first things I talk with people and ask them about in my office is, what do you believe in? And it doesn't, sometimes they'll go, oh, you know, I'm Christian. Well, that still doesn't tell me what you believe in. It tells me one little tiny piece of it. Or somebody will say, well, I'm Jewish. And I still have to ask, what does that mean to you? What do you believe in? Because even when you associate or identify with a particular religion, that interpretation is very personal. And it varies from one person to another person. And from my perspective as a psychologist, I don't care what you believe in, but I want to know so that I can help you use that in your life to heal from whatever issue that you're dealing with. Now, Barnabas just passed out a few things to give you some information about different diseases and disorders. So I'm not going to go into a lot of detail about what anxiety is, what depression is. That's easy enough for you to take a look at. I'd rather talk about the process of healing. Now, belonging to a group, that sense of belonging, is also another very important piece. Whether you identify and, I've known people here that play bridge 4 or 5 days a week, and that's what's gotten them through the tough times. That's what's gotten them through the physical pain or the pain of loss that they've gone through. And it's not that it's bridge, it's that they have something to look forward to, and they have a group of people that they're counting on being with. Whether you're playing against somebody, but you always have a partner when you're playing bridge that you're playing with. There's also a lot of statistics about church membership or any kind of religious membership. People do not get sick as rapidly with any illness when they're involved in a community. And when they do, their healing is faster than when they're isolated to themselves. Now, Barnabas mentioned the chair volleyball, and I don't know how many times I've walked by and I've heard people laughing in there. There's also research on laughter and how it helps fight depression. It helps to reduce anxiety. You get distracted from the negative feelings that you have at that moment. And that's a good thing. It's a healthy thing. It releases some natural hormones that work as natural antidepressants. So whenever you have a chance to do something that is going to bring you laughter, jump for it. It's an important piece of staying well. As we go along, if people have questions or comments, I'd like you to raise your hand to interrupt me. Things work better when there's an interchange. Okay?
And if you have any questions about the value of therapy, you can ask her. You're like, hey, I'm scared of therapy. What is therapy like? Things like that. You can be sure. Hey, how about that one? What is therapy like? Why is it like? Why is it? Because I know for me, I always had a stigma of I'm sitting there talking to a person. I can talk to someone else. I don't really have to talk to a person about my problem. There's no answer. Why should I go to therapy?
Often you have the answer within you. By talking to someone who you recognize can be objective, they're not part of your family or part of your immediate group, who has the ability to reframe for you, to feed back to you what you have said. And also, when you are putting something that's going around in your head over and over again, when you put it into words that someone else needs to be able to understand what you're saying, you actually clarify it for yourself as well. You're the one doing the work in therapy. It's all yours. What the therapist does, it works as a guide, helps you to find pathways that you already have available to you. You know, like when I point out the laughter that comes from playing chair volleyball. It's been here all along, but you've got somebody else saying, you know, that might be helpful to you. Because it gives you a group to do something with. You're going to get lots of laughs, and you're going to get some movement and connect with other people. So it's there. The community offers it, but sometimes you need somebody to give you a little push in the direction. Now, in terms of spirituality, there's something else that I wanted to point out that is it's built into cognitive therapy, but it's built into many religions as well. When let's say you're Hindu. Hindus do a lot, and Buddhists, they do a lot of chanting. That process of singing changes your breathing. We use breath all the time in cognitive therapy to reduce anxiety, to get people to be able to focus on what's really going on and not be scattered all over the place and not know where to begin when they're having an issue with something. In Catholicism, they have this thing called the rosary, where you're repeating the same prayer over and over and over again. You're actually saying the Hail Mary 53 times if you get around once. To say the full rosary, you're actually supposed to do it 3 times with different intents, but that's a whole other issue. Most people never get that far because saying it 50 times, and there's a couple of other prayers that are in there too. But it's that process of taking your mind off of whatever else is going on and putting in something else. Yes?
Does that rosary also act sort of like the people that use worry beads?
Yes, it does. It's very similar to the Greek worry beads. The Greek worry beads, as you're going along with the beads, there's different sayings that you have. That's a good example of it as well. So there's things that a number of religions do that are there that have this side effect of helping psychologically. And a lot of the exercises and things in cognitive therapy do the same thing. So if you already have something like that in your belief system, you use it because it works. And it doesn't mean that you're becoming a holy roller or that you're focused only on your religion, but you're using something that you've learned and has a meaning for you as well.
Any more questions? So what does a therapy session look like? If you have to sum it up in like 2 minutes, I know that's a deep question.
Well, part of it is it's very different for different people. Sometimes we're focused on just learning how to relax. And so we're working on relaxation exercises. Sometimes we're working on pain management, where you're using, the word scares people when I say hypnosis, but hypnosis is the same thing as a very deep form of relaxation where you're able to focus your attention. And that's really what they use for pain management. People are ready to go out and take a pill for their pain, but what they realize, unless you're getting the injection in your knee or your back, the medication does not go to the site of the pain. It goes to your brain, and it says to your brain, don't recognize the pain signals. You can do that yourself, but it takes time and training so that you get to the point that you can do that. So sometimes people come in just for pain management. So it's very different depending upon what the issues are when someone comes in. If it's about grief, then a lot of that has to do with what do you believe, what do you expect, what was your life like, how do you redefine your life now that person, or maybe it's not even a person with grief, maybe it's the loss of some ability that you have relied on your whole life. Sometimes even just you can't drive anymore because of your reflexes or your sight or your hearing, and that's a major loss. It's a loss of independence. So sometimes it's dealing with that kind of grief. It varies. So when somebody comes in, the first question is, what do you want from it? Why are you here? And then the therapist will focus that in the direction that you're asking for, that you're needing.
I have a question. So
not for personal, but let's say I have a friend that needs, you can tell that they need some sort of therapy or uplifting. What do you suggest to help that person go to therapy?
How do you get them there?
Get them there, yeah, like slowly, but what are some tools that you recommend?
Sometimes, if it's a real friend that you feel comfortable sharing something about yourself, sometimes if you're able to share something in your life and how you reached out to others for help, and if you know somebody that you can refer them to, you can say, oh, I saw this person, or my friend saw this person and they really got help with it. Sometimes you can use my friend had this problem, if you're uncomfortable revealing too much of yourself.
Well, and no disrespect to the crowd, but I see in the older generation, especially the men, it's more of a pride. They don't want to admit.
Well,
how do you get them past
okay.
that?
Part of getting past that, it's not so much pride as having to look strong and manly and being able to accept that having emotions, having feelings is also manly. It's how you handle them and what you want to do with them. And if you need some help, not everybody's a car mechanic. If something happens with their car, they go to a mechanic, they reach out for help. If you have the flu or a cold, you're willing to go down to the clinic and say, help me with this. You don't have to do anything on your own. And again, back to community, Barnabas was talking about, having that community, having somebody else to connect with, and that support system is a big deal when it comes to getting better, whether it's physically, emotionally, or mentally.
Any more questions? Maybe a round of applause. Thank you so much. Let me give you some love. I love you, dear.
You're too tall for this. You gotta bend your knees.
Always. Now I'm gonna have Tony come up. I have him deeper in the program, but since he's here, we're gonna move forward and come back. But Tony, I'm gonna invite you up to talk about physical fitness, and we'll close with our breakout. Azalea.
All right, lucky me. All right, so now I know why there was only one person in class this morning. You're all here for the free food. Wow, I get, really?
Yes, come on.
I have to look at myself speak? Whew. Thanks for coming. Good to see you all. We'll start with what we keep talking about, community. I'm a big fan of the Blue Zone. If any of you are familiar with the Blue Zones, it's the study of the longest living cultures across the globe. And one of the common themes that the people that live the longest and the healthiest have is they have a very strong sense of community. They are connected to the group of people that they live with and around, either through their spirituality, their religion, their activities. Some of them depend on each other just to survive with the farming and all that stuff. So for people that live the longest, their sense of community is very, very strong, and they count it as one of the things that helps keep them active and going. So I was asked to come here to speak about mental health and the benefits of exercise and activity. I'll try and keep it brief because there's a lot of things that we can talk about here, but I'll try and stay on point. According to the National Institute of Aging, exercise helps reduce feelings and depression and stress. It enhances your mood and overall emotional well-being, increases your energy level, and also improves your sleep, according to the research. And all the things I'm going to share here are research-driven. So the effects of exercise and mental health. We talked about reducing stress. It increases happiness, and in a moment we'll talk about why. It decreases sadness and loneliness, and we're going to talk about loneliness for a moment. And exercise has proven to reduce depression and anxiety. In some cases, exercise has been shown to be as effective as pharmaceuticals and or psychological therapy. So I don't recommend you giving up your pharmaceuticals or your therapist, but for some people, the impact of exercise on what ails them is tremendous. So why does exercise have such a positive effect on the body? Exercise boosts the body's production of endorphins. Endorphins help you relax, they help you feel less pain, and they also help you feel more pleasure. So that combination of those two goes a long way. Exercise also helps increase dopamine and serotonin in the brain. These chemicals make you feel happy. So the more of those chemicals you have coursing through your body and your brain, the happier you will be, which is why so many people come out of exercise class with a big smile on their face, in addition to sweating and being tired. So, and the added benefit of community. So anytime you're in that class, if any of you have ever attended class, you can attest to the fact that it is definitely a community in there. We laugh, we joke, we make fun of each other, we make fun of ourselves, but we move and we have fun in there in addition to all the other physical stuff. I do my best to try and mask the physical stuff so that the discomfort and pain that you're enduring in there is more laughter and fun than pain. And so, and if you don't believe me, ask some of the people sitting at your table, because I recognize most of these people from class. So I'm somewhat preaching to the choir. Exercise also helps reduce your cortisol levels. And if you're not sure what cortisol is a chemical that you don't really want a lot of in your body. It does a lot of bad things, and what drives cortisol in your body is too much stress. So when you were talking about yoga and you were talking about meditation and some of the other things, those things all help you reduce that cortisol level whether you realize it or not. And one of the benefits of exercise is your ability to buffer stress better than people that do not. So community leads me to the thought of loneliness. If you're paying attention to the research and in the mental health world, loneliness is an enormous epidemic throughout the world. A lot of people, young and old, feel very alone. And that sense of community gives you somebody to connect to. That sense of loneliness is terribly troubling and a tremendous stress and very, very unhealthy. So whether you go to spirituality, you go to exercise, you go to therapy, you go to play cards, whatever it is that you do to help bring that level down helps keep you healthier, not only physically, but mentally. When exercise becomes a habit for some of you and it's part of your lifestyle, it also helps boost your self-esteem and self-worth. And those two things together, internally, an intrinsic thing, just make you feel better and stronger about handling all the crap that comes at you and all the things that you have to deal with in life. So there's a study here that had over 1 million subjects in it, and it said with regular exercise, the decrease of 43% in the number of poor mental health days that people had versus the people that did not exercise. So if you told me I could do something that would reduce my unhappiness by 43%, you have my attention. And exercise is that wonder drug that you have at your availability. So I would recommend that you take advantage of it, whether it's with me in class with the rest of it or on your own. Okay, it doesn't have to be in a group, but I would recommend that you move. I was fortunate enough at one of my stops in my career to be associated with Florida Atlantic University. The Annie and Lou Green Memory Wellness Center over there had a research group, and I got to meet with them on a regular basis. And they shared a lot of information with the residents that I worked with then. And I'm going to get real scientific here, but I'll be quick about it. And I'm going to read you some of the scientific effects that exercise has. So bear with me here. I'll read it straight from the page. Regular physical activity significantly reduces symptoms of depression, anxiety, and stress while enhancing cognitive function and self-esteem. Exercise improves mental health by altering the neurotransmitters. I know we have a lot of big words coming up here. Neurotransmitters and neurotropic factors, which may decrease the load and improve mood, emotional regulation, cognitive performance, and stress resilience. Exercise increases the production of brain-derived neurotropic factors, a protein required for the survival and proliferation of neurons in key brain areas associated with learning and memory. So, Translation into English, when you exercise, your brain is growing and it is creating new neurons and new cells. So yesterday we did drum class for all of you that were in there. For most of us, that was a new skill that required our brains to work in a way that they've never worked before, both rhythmically, musically, and coordination-wise. So your brains were creating new pathways to learn new things. So when we always tell you guys to learn new things, I know Laura upstairs is always preaching to you guys, brush your teeth with your other hand or do things differently. She knows what she's talking about. She's dealing with this thing here with doing new things makes your brain new again. So there's a few more here. Exercise promotes neuroplasticity. So that's basically what we just talked about. It's going to create new cells and new pathways in your brain that allows the brain to forge new neural connections, critical for learning, memory, and recovery from mental health issues. So again, why does that happen? As you are exercising, the blood is pumping, the oxygen is going through, things are going. When you exercise, it's not just your body that is getting the oxygen pumping through, it's also your brain. So the more you can get that blood flow and that oxygen to pump through, the healthier that is for your brain. That was the number one thing that the researchers repeated again and again ad nauseum about the benefits of exercise and your mental health. The more you can move on a regular basis, the healthier your brain's going to be. All right, last paragraph. Exercise enhances cerebral blood flow, which we just discussed, which increases the transport of oxygen and nutrients to the brain. This not only promotes overall brain health and function, but also improves cognitive performance and protects, again, keyword, protects against cognitive decline with age. Thus, exercise emerges as an effective, natural method for maintaining mental health and cognitive function, providing robust protection against the negative consequences of chronic stress, thanks to its combined effect of improving cardiovascular health, increasing blood flow, and triggering neurochemical changes. So, everybody understood that? I know I used a lot of big research words, but they spent a lot of time studying all that stuff. So I wanted to let you know that this was very research-driven, that stuff, and not just something that I yanked off of the internet here for you guys. So we do have a group exercise schedule if that is your thing. If you need to be connected and part of the community, we do have volleyball. Those activities are fun. They are demanding at times, but no one there yet has had a problem with the demands of the physical part of the classes. You, on the other hand, are a different story. We can deal with Barnabas. Next Monday, I'll do a little promotion here for fitness. We have the Thrive screening. If you had not had a Thrive screening in recent times, I would invite you to come up to the auditorium next Monday between 11 and 12:30 and join us. Those physical tests that we do for you give us indication of things that you need physically to help keep you stronger. And those things will also help with your brain as you get stronger through that. So if you are unaware, or you haven't had a Thrive screening, just please come up and participate with it. Any questions?
I think they're supposed to call and let people know that you're coming.
They're supposed to call us, or I'm supposed to call them?
No, they're supposed to call, I guess, Stephanie's office. I think you can just show up.
Yeah, I mean, I'm granting the invite because Stephanie is out. So I'm just telling you, you can show up. We'll be there. We'll take all of you on. If you're willing to come in and do the screening, we're willing to take you. So forget about all that formality and phone calls and all that stuff. If you decide at the last minute you want to do it, you show up and we'll take care of you.
How often should you have a Thrive screening?
Once a month would be a lot, but at least once a year is what we normally recommend here, because that'll give us a baseline of where you are with certain components, and then that'll give you some time to work on it. Maybe you improve it as you get older. Even if you can just maintain where you are, that's definitely a sign of progress with your work in the program. So you could do it every month if you wanted to. You're not going to see that much of a change. We offer it every month, right? Because we don't need all 500 of you coming in at once. So Stephanie kind of spaces that out every month. So
typically Stephanie invites on your birthday month, so that
Yes.
you remember the following year, your birthday month, you go and you have another Thrive, so that gives her an opportunity to see the gains, hopefully, and not any losses in your Thrive.
And with Thrive, aren't there different components that you can participate in?
There are a bunch of components that we test you on: grip strength, leg strength, cognitive ability. Yeah, show up and we'll go over all that. Each one of the therapists, it's a team effort with all of us. So all of the therapy team and myself are all working with all of you as a collective group. So any other questions? Don't be shy. Thank you guys all for coming. Appreciate it.
Thank you.
There you go.
It's good to see you. It's so great to be with everyone again.
Yeah, it is.
How have you been?
I'm not good. I haven't been good. The truth is, for a while now, I feel like I've been stuck in a dark place. I can't remember feeling happy. No one really hears me, you know? I'm good. Yeah, things are good.
That's great.
Again, through therapy, through exercising, and through spirituality, there's one common thread through it all: community. There's someone there to walk you through your problems. The one commonality is community. Let me say this to you all before you leave today. If you don't get anything from today's presentation, it's simply this. I want everyone to pay attention to hear this. Just everyone, I want you to zoom in, please. You were not meant to live life alone. Turn to your neighbor and say, you turn your neighbor on your right and say, you were not meant to live life alone. Turn to your left and tell your neighbor, you were not meant to live life alone. And I'm going to say this to you in closing as well. We went over 3 areas that can help you have a happier life. Anybody desire to be happy? Raise your hand if you want to be happy. That's everyone. So no one has an excuse in this room to leave here and not seek happiness. Out of those 3 areas, you have your answer to happiness. Find one that fits your lifestyle and experience the joy of having a meaningful, fulfilling, happy, peaceful, joy-centered life. Because here's the truth. It's possible even if you don't feel like it. Say it again. It is possible even if you do not feel like it. One of the biggest things, the worst thing you can do is leave here and not give it a try. Leave here the same, with the same problems, with the same situation, going through the same hell, and not trying one of these 3 areas. Don't be that person that dies from not having community. Thank you guys for being here. It's an absolute joy to pour into your life. I hope that you got something for it. And just know that I'm here as your chaplain if you need me. Tony's here as your exercise coach if you need him. And Dr. Lacadera serves our community in many capacities. Her card's on the table. So you have the resources. Take the action. Thank you guys for coming. Have a blessed day.